Good afternoon. I'm David Baker, City of Milwaukee Health Commissioner. I'm joined by Dr. John Swine, Chief Medical Officer for the Health Department, and Paul B. Driscoll, who's the Division Head for Disease Control and Environmental Health. Thank you for joining us for this update regarding our investigation on H1N1, swine origin influenza virus. To date, the City of Milwaukee Health Department has a new update in terms of our probable count of cases. We now have 36 cases of type A H1N1 influenza for the city. 2 of those cases have been confirmed by the Centers of Disease Control. Earlier this morning, we convened as a team, and Mayor Barrett and I had an extensive conversation with dozens of epidemiologists from the Centers of Disease Control Outbreak and Global Migration Division, as well as the State Health Officer and other key leaders from the Division of Public Health regarding the severity of disease circulating nationwide. I will be providing an update on school closures tomorrow, and what my advice is to parents. I urge all parents to make whatever plans they need to in case their kids are not able to attend school on Monday. What we can tell you after our discussions with the Centers of Disease Control, the Centers of Disease Control indicates that surveillance regarding illness nationwide is indicating that this particular strand appears to be mild. Few cases have been associated with hospitalization, and here we're seeing the same thing transposed locally. So we have few cases that are indicating hospitalization, and it appears to be mild. However, a word of caution. Influenza in our community should be a concern, even if mild, because every year nearly 36,000 individuals die from influenza. And while we work with the Centers of Disease Control and our State Division of Public Health, we want individuals to keep in mind the following. We want you to stay at home if you're exhibiting these signs of respiratory illness. We don't want you to return to work or school. We want you to monitor this illness and contact your medical provider if you believe that you have fever, cough, or sore throat, or stuffy nose, as has been said many times before. We have to stress good hygiene once again as we try to get our arms around this current outbreak. Frequent hand washing cannot be oversold. I also wanted to state that we've had good response from our community partners. Our hotline has been very strong. 211 calls have been heavy, which is one of the partners, and we want individuals to continually call the Milwaukee Health Department hotline in 211. Our hotline is 286-3616. We also refer individuals to our website for materials, both in English and Spanish there, milwaukee.gov/health. And we will continue to work around the clock as we, along with other local public health professionals across the nation, try to understand how this virus is circulating in our communities. We do know that the transmission in other cities is just as it is in ours. Case counts are going up, and in some cases case counts are exploding. We believe that there's much more to be known about this novel strand, and because it is a novel virus, we need to be certain that we understand how we can take precautions to protect the public's health. The actions that we've taken this week have been prudent as we deemed them to make certain that we can get out in front of this. So with that being said, I'm willing to take some questions at this time.
Mr. Baker, is there any indication that the rate at which this is spreading is slowing at all?
We believe that the rate in which we're surveilling disease and collecting specimens and samples would suggest that we are in the midst of an outbreak. We've not seen anything slowing of that. That may be part of our messaging and part of the incubation period associated with this novel strain. So it's not slowing, but we do believe that we're working with medical providers to take samples from those who are exhibiting symptoms.
You said that there are 36 probable cases, 2 are confirmed, so that would be 34 remaining that are probable and not confirmed yet. Is that accurate?
That is correct, and those probables will follow the transition of the two that have been confirmed. Those samples will be forwarded on to the Centers for Disease Control in Atlanta. However, we do, along with the Children's Hospital and Health System and Wisconsin State Lab of Hygiene, have the capacity to provide those same confirmation tests, and they will be done on the ground this week. So we'll have much more rapid turnaround in indicating that we have confirmed cases as the week goes on.
So it won't take as long as those original cases that were confirmed today after being announced earlier this week?
Well, it will take some time before the Centers for Disease Control updates the national bulletin board that shows the confirmed cases for the state of Wisconsin. As you all know, we were not there until this morning. They have a queuing and they have a checking and balance that they have to do. We will know here in Wisconsin what is circulating and what has been confirmed before it makes the national bulletin board.
Do you know yet how the new cases are going to affect Milwaukee Public Schools?
Our team has been convening all morning and will convene through the evening, and I will update how this will affect school closures tomorrow, along with the rest of our staff here.
What specifics can you tell us about the 2 confirmed cases?
Pardon?
What specifics can you tell us about the 2 confirmed cases? Do you know how they contracted this? Any ages, any details whatsoever about the 2 confirmed cases?
Well, I can reiterate what we stated early in the week, that one was an adult and one was a child. And certainly we're looking at their travel history and how they came in contact with this. And that's spurring on our investigation. It's provided good insight to how this disease is translating itself in our community.
Are these cases county or city?
These 34 probable and 2 confirmed are all city of Milwaukee.
You mentioned that this is a relatively mild strain. To your knowledge of these 36 cases, are any of these people in serious condition? Is that something that you can tell us?
I don't have any data regarding these individuals. I do know that all cases that were indicated as probable positive, that information has been sent on to their medical providers, and they're receiving the appropriate follow-up, which would include at this time possible antiviral medication.
What can you tell us about the probable cases and with any association to the Milwaukee Public Schools? I know that there have been a lot of closures there. Have you been able to, I guess, connect probables with schools? Is there any relationship there that we should know about?
Well, we know that the distribution of caseload has suggested that our focus be on school-aged kids, but that could change at any time. To date, we've had need to issue closures to school, and we're looking now at how widespread that will need to be, and we'll make that determination. The epidemiology that needs to follow up is being conducted as we speak, and we will look at the distribution of these cases. Some of them will impact school age, some of them will impact adults, and we'll make that determination. Now we have to find every individual that comes back for probable positive. If it leads us to a school, then we'll make the appropriate decision at that time.
So it's accurate to say that the majority of those cases are children, since your focus is on school-aged children?
We focused on school-aged children for 2 reasons. One, schools are venues that speed the transmission of communicable disease. We know that. We're always telling kids to wash their hands. But I haven't seen that data at detail. I'll defer to our epidemiologist here, Paul Beatrice, who may have a little bit more to say about that distribution.
Just a little bit, and Paul Beatrice, Director of Disease Control and Environmental Health. So we're beginning our phase now of characterizing disease occurrence and spread in our community. And the distribution covers a wide age range. At this time, we can tell you that there are lots of school-age children involved. And as Commissioner Baker mentioned, we focused on schools appropriately since they tend to be key points of transmission in the community, both children and those institutional settings.
Of the 2 official cases, do we know when it was contracted? Is there any timeline that you know about the 2 official cases at this point, when it started?
While staff have that data, and it's part of our investigation, I don't have it here in front of me. We do know that that our investigation from when we came out early in the week, that is something that we're zeroing in on, and I don't have that data, and I don't think staff here have that data either.